Hi, I'm Joy Pelopero, and I'm going to be going over type 2 diabetes. There's a lot of information to cover with this type of disease, but for this presentation specifically, we're just going to go over the symptoms and complications. So the objectives. What is type 2 diabetes? The symptoms to look for with high blood sugar, and on the opposite end, the symptoms to look for with low blood sugar, and the complications that are involved. Some of the facts about type 2 diabetes is that it's the most common form between the two types, type 1 and type 2. It's insulin resistant, which means the body does not make or properly use insulin, and insulin is an important hormone that brings blood sugar, also called glucose, into your body's cell to be absorbed and used as energy. It's also a progressive condition, which means it can get worse and it can potentially affect other organs in your body as well. But there are treatments such as lifestyle changes, oral medications, and insulin. Hyperglycemia, or high blood sugar, it's an excessive amount of sugar glucose in the blood when the body does not produce or use enough insulin. So some of the symptoms that you'll see with these individuals are things like dry mouth, extreme thirst, on the opposite end, extreme hunger, drowsiness, so they're just tired all the time, urgency to void, so you'll see these individuals running to the bathroom pretty frequently, irritability, and stomach pains. Hypoglycemia, or low sugar, it's very low levels of blood sugar glucose, which is the body's main source of energy. The symptoms that you will see are things like sweating, shaking, increased heart rate, impaired vision, weakness, pallor. These individuals their appearance will be kind of ashen, pale, loss of color. They'll also have headaches and hunger. If you look at the picture on the bottom right corner of your screen, you'll see that of the people living with type 2 diabetes, 54% have never seen a dietitian, 64% have never seen an endocrinologist, 63% have never seen a certified diabetes educator. So if any of these symptoms sound familiar to you or to anyone else you know, please seek proper, appropriate medical attention. And if you look at the picture on top, you'll see what it shows, where the glucose, what it looks like for normal glucose in the bloodstream and an excessive amount of blood glucose in the bloodstream. The goal of all diabetics is to maintain normal blood glucose levels. The complications of diabetes type 2, it's chronic and long-term complications. So you'll see it affecting other organs like the eyes and the kidneys. You'll see retinopathy with diabetics. More than 70% develop it eventually, which leads to damage to the retina. Nephropathy, which is kidney failure. And you'll see that they'll produce more waste products in their blood and protein in their urine. These individuals will most likely need to have some sort of dialysis access. It pretty much acts like a kidney when the kidney fails, and it'll keep the body in balance by removing the waste and water from building up, and it also keeps certain chemicals in check as well. These individuals also will have peripheral, mono, or autonomic nerve damage. They have several foot problems, which leads to foot ulcers. They usually have to check their feet on a regular basis. Foot ulcers are a combination of nerve damage and damaged blood vessels, and they have very poor healing. And macrovascular disease, which causes 3/4 of the deaths in diabetics, it's due to buildup of plaque deposits in the artery, which leads to heart attacks, strokes, or peripheral artery disease. Other complications are things like cataracts or glaucoma. Cataracts are clouding of the lens of the eyes. Glaucoma results in damage to the optic nerve. You'll see skin changes in these individuals, such as shin spots, the reddish brown scaly lesions, oral issues, dental changes, cavities in the teeth, gingivitis, periodontitis, and a burning sensation that they normally feel in a dry mouth. So the take home in this presentation should be to be aware of the symptoms of low and high blood sugar levels, to manage low and high blood sugar levels appropriately, and know that although it's a chronic condition, are the most common, they are preventable and can be effectively controlled. The goal is to maintain targeted blood glucose level and lifestyle modifications. Type 2 diabetes can be fixed with lifestyle modifications. And to reiterate, things like proper nutrition, regular physical activity, a minimum about 30 minutes a day, foot inspection, especially after physical activity, and the big goal is to reach a healthy weight and control that blood sugar. Diabetes ultimately affects your blood vessels, which can lead to more complications. Diabetes affects millions of Americans and impacts their daily activities. So diabetes education is very important, so it makes you more aware of it, how to treat it, and it gives you the power to control it.